Welcome, everyone. Today we're going to talk about mental health in the workplace. This is a webinar based on a course I did at the Global Summit back about right before COVID started. And it's such an important topic because in root cause analysis, one of the things that we deal with is human performance. And human performance is always affected by your mental well-being. And so it's really important that we know how to handle those situations in the workplace, make sure that people have a well-balanced work life, and if they're having some situations that are difficult, how we can help them through those so that they can be safe and happy on the job. Today, Emily Pritt is here with us. Emily, welcome.
Hi.
Give us a little bit of your background.
My background started academically in psychology, and I'm wrapping up with a PhD in social psychology. I also do some training in protective services, so I deal with things that might be in the category of mentally ill with de-escalation, law enforcement, stuff like that.
Very important. Very important. You hear a lot about those types of things these days. Well, one of the things I think we want to accomplish, or several of the things we want to accomplish in the webinar today, is it's kind of a broad topic. We could probably talk about it for hours, but we're not. We've got a set time frame, so we can't dig as deep into some things as we would probably like to, but we're going to do a overview of some things that we feel are very key and something everybody can participate in. So let's start a little bit with the definition of, what is mental health, mental illness, what's the differences in these two?
I think a lot of times people put them interchangeably, and they're distinctly different. Mental health is something that all of us have, and it's important just as much as our physical health, our body, mentally, physically. We need things to make sure that we're performing optimally. When we talk about mental illness, this is a clinician that has a diagnosis. A lot of times, like for instance, somebody could be depressed and not meet the criteria to have a formal diagnosis of like major depressive disorder, but could still have symptoms of depression. So we're not talking about that. We're not getting into things where maybe you would need to talk to a professional.
Right.
My background's academic, so I don't see patients or anything like that. But mental health and the things we're focusing on specifically in the workplace are things that we can do to have a more productive and happy time because we spend majority of our time at work. So
and to kind of, when things come up, guide you in the right direction.
Absolutely.
Kind of give you a few points on maybe thinking about your own mental health at the time and things like that. Why is this important in the workplace? I'm going to go over a few little statistics that, anytime you mention mental health, it almost, whether it's health or illness, it tends to still have a stigma attached to it, which is, it shouldn't, because it pretty much affects the majority of us. These are statistics from 2022, and in the description we can link where these were resourced, so you can look them up for yourself. But just in the U.S. Alone, in 2022, 23% of the adults experienced a mental health condition. 6% of those were serious mental health conditions, which were defined as psychotic disorders, bipolar disorders, severe anxiety. 32.9% of the U.S. adults experienced both mental health condition and substance abuse. That statistic's really getting up there at that point. Approximately 5.2 million veterans experienced a behavioral condition, and the impact of depression and anxiety alone globally on the economy measured $1 trillion in lost productivity each year. For those that want the dollar amount, it's massive.
And
it's huge.
I want to put a point there too about, you mentioned PTSD.
Yes.
And a lot of stigma or misthinking is
Yes.
that, well, only soldiers have this. If you were in the military, those are the only folks that could have post-traumatic stress disorder, which is not true.
Not the case.
And when you think about your place of work, if you have vendors, clients, and other employees, because it affects every single one of us, I've been working where there's been an attempted suicide.
Mm-hmm.
You may not think that it's the people that you work with, but it could still happen on your facility grounds. So kind of paying attention to all these different things and being receptive and empathetic is very important. It's not to say that we have to tiptoe around people's feelings, and it's not that. We all deserve a certain level of mental well-being and emotional well-being, and to just strengthen that is really the focus here.
Because everybody is experiencing something, whether it's they're having financial difficulties. This is anything that gets their mind off of the job. Affects the workplace.
And we know if their mind's off the job, that's where we start having accidents,
start having trouble.
Incidents
and
occur.
It could be they're going through a divorce, or they're just going through any kind of a rough time. It can make it hard for them to put one foot in front of the other, to get through life in general, but much less get on the job. And situational awareness kicks in, problems like that, where it can suddenly be something that could cause a bad accident, and they don't mean to.
Right. And there's probably people thinking, well, I'm not in HR, that's not my job, that's not my role. But knowing how to, if I can't solve the problem, but I can refer you to someone. If I have resources, I can, get somebody, carry them to the next step.
Yes.
That's being responsible. That's being a good human.
Exactly.
To say, I'm not sure about that, but here's this pamphlet, or hey, go see this person. They'll be able to help you.
And who sees everybody more than anybody else? There are people that they work with. Very often these people can go home and isolate.
Yeah.
And their family doesn't see maybe what's going on with them. If there's somebody who internalizes a lot of things in the workforce, you're watching them perform. And you're watching your friends perform, and you know what they're like on a daily basis.
Yeah.
You know if something just doesn't seem right. And that's when it's like, well, what do you do? I mean, I don't want to intrude. I don't want to, but there's some responsibility in a lot of this, because especially if there's somebody that has a job where they're working with very dangerous equipment, or their job is to be the eyes for somebody else working that equipment, or something like that. Well, if they're distracted by whatever's going on in their life, that affects way more than just themselves. And so that's when, as a manager, your eyes need to be on all of this, and be aware. Who are you? Who do I work with? What do you like? What do you've got to get to know people, so if something changes.
If you're approachable and people can come to you, and there's also a fine line just with confidentiality, and I may ask you, hey, I noticed that so-and-so seems a little on edge today. If I don't know them personally, I may come to you because you may have a better relationship. But it's also, again, we have to be careful about just kind of putting it all out there for everybody. So each situation is different. But it again, that's that overall, just kind of paying attention, having the situational awareness, kind of listening, being empathetic and active listening, and just, if you notice something's off, it's like, see something, say something.
Exactly.
There's still places that you can go without feeling like you're gossiping.
Right.
Just to say, hey, I noticed somebody seemed a little sad today. Just wanted to say something.
And your HR department is probably that first, either the manager or the HR department. It's very important to know what that hierarchy of what's the word I'm trying to think of, conversation, or is supposed to be. And the company should let people know, here's the people you can talk to when you're concerned about something. Another reason this is so important, that companies really are aware of all this stuff, because there's sometimes that what's going on the job could be related to some of this stuff, whether it's overwhelm, burnout, because of scheduling. Things like that can really cause so many problems in somebody's life. But what if that person got hurt on the job and now they're taking pain medicine because of an accident that happened on the job?
Oh, yeah.
And you're rolling now into a totally different ball game, because addiction is a big deal. It's so rampant these days, and very often it starts with an accident and just going to try to get help. Yeah. And then it gets out of control before the person even knows that happened. And as the employer, if they got hurt doing something that they got in that situation because they got hurt on the job, you've got to watch out for them. You've got to help protect them. And what would you suggest if you were a manager and you kind of started noticing something like that going on and you were concerned?
Well, with especially in the region that we live in with opioids, and just it is a big epidemic around here, is having some resources to understand what those early signs are, and some of that's agitation. That's a big one. If somebody's not acting like themselves, that's a big one. Or picking up other behaviors, just being really reckless. That's probably some key indicators right there.
Not showing up
would be another one. But then again, because of those kind of fine lines, if they have a prescription for it, they're not doing anything wrong.
Right.
With a drug test, it's going to say, well, this is what I have because of that. So a lot of it comes down to education.
Yes.
Education and awareness.
Yeah, absolutely.
And that comes from not just the physicians that are prescribing the medication, but for the person taking it. And maybe even some posters and things around the break rooms, just to, because if it is a type of job where a lot of people are getting hurt, just to have that awareness that, hey, we are here to help. Also with insurance, I know a lot of different insurance providers have a mental health aspect. Years ago, it used to be you only got so many visits a year, and now, we've got telemedicine and a lot of different resources to make it still something that we can do on our schedule that's private, comfortable, without having to leave work and go drive somewhere. You can do that, at the comfort of your own home, in your car, wherever that is, and ensure that you're getting whatever help you need.
I like the point you said about making the resources accessible, so that somebody could, very quietly get a pamphlet or get something, or if there's a way they can on their portals on their computers access, but they need to know that those things are there for them.
That communication part is extremely important. A lot of times people assume everybody else knows what to do, and so the more you can have something forward facing, whether it's signs in a common area, while you're sitting there waiting on your microwave and your food, and you're just like looking all around, you would just keep seeing something. 988, this is a crisis prevention line. You can call it, text it. It's there all the time. It's another one. Just the more you can have exposure to these things, the more it's there and it's available. Instead of like, well, I don't know. It's the worst thing.
Well, and employee reluctance is a big part of all of this, because first of all, no one wants to admit something's wrong. Now if you have a if you have a broken arm, not a problem. But people or some other type of medical issue, people are more comfortable with those situations, but that stigma is still there, even though, as we saw in the statistics, it's the majority of us that are dealing with something at any given time and need assistance. We're not personally trained ourselves to handle these things.
And so bringing awareness to mental health is a big component of this, to say that stigma, even nowadays, that there's people who, don't want other people to know that, if it helps you, take it, right? If you can function, if you're happier, take it.
Yeah.
There's a lot of different things that people can do for poor coping, but when you have a provider that can listen to you and give you the help that you need, then that does make, everything seem so much better.
It does.
And so, some of those things of, maybe, am I overwhelmed? Am I suffering from burnout? Do I have some symptoms of depression? There's a lot of resources out there too where you can do a self-assessment that's anonymous. And if you have a lot of people telling you, are you okay? I think you might need some help. Then that's probably a good indication too that hey, maybe even though I see myself in the mirror every day, maybe I'm missing something. And if you don't know where to start, that's where those resources come in hand to just say, call up that number to say, hey, everybody keeps telling me that I seem on edge and am I okay? And I'm not sure if I am. And there are trained professionals that can walk you through some steps and see what that looks like. The other part of that is, it's taking things a day at a time. I don't know if you're going to take medicine for the rest of your life. I don't know if you're going to have therapy or what that looks like. But it is one step at a time. The medicine might not be the first thing to work, but when we're talking about general health across everybody, we've got things to do to make sure that we're performing our best. And I think it's been kind of told to us ever since grade school, make sure you get enough sleep, eat breakfast, eat 3 meals a day, all that kind of stuff. But we're all still so different. Exercise.
Oh, my word.
But what works for you? I don't eat breakfast.
I don't either.
Breakfast is actually the first meal of the day, which for me is at noon.
Yeah, me too.
So
everybody's built different.
Absolutely.
But there's some warning signs. So, like, are you? Here's just a few warning signs somebody could look, like, if they're wondering, because I know when I've gone through some spells of things, I'd be like, how do I get myself going? What's going on here with me? And increased absenteeism and tardiness, withdrawing from social interactions. Now, I mean, you can be an introvert and enjoy people in limited abilities. That's totally different from just withdrawing.
Yeah, I think it's more things that you used to enjoy and now you no longer want to do them. Then that's a major behavioral change.
Major, yes. Is this a change from who you normally are? You're missing deadlines or working slowly. You can't concentrate. Tiredness and low energy. You're not being able to keep up with the time or your performance, and you may start leaning on things like tobacco, alcohol, or drugs.
And looking at that, through the lens of mental health, we also have to, sleep can affect a lot of that.
Oh, yes.
So I would first say, am I getting enough sleep? Am I eating? Am I nourishing my body? Do I have enough cognitive function to get through things? And also, what's my baseline? Am I always late? Am I always tardy? Because me being tardy all of a sudden is a lot different than habitual tardiness.
That baseline is, you're correct. And everybody kind of knows what there is.
Yes.
You know when things are going smooth for you and what that looks like and what that feels like.
It's like Mondays. Mondays for me are never, and you could call it any other day. It doesn't matter. It's just that first day of starting everything up again. I don't want to get out of bed. I'm just every Monday.
Yeah.
You could make Monday Friday. It's still going to be the same problem for me.
I'm with you. I'm with you. I'm right there. And then Tuesday, Wednesday. That's my baseline. So if you're a manager and you're seeing something that's troubling you, you're worried about somebody, and it's time to talk, there are some things that you've got to make sure of several things. One is, are you the right person to do the talking?
That's big.
Are you the person that should do this? If you are you in the right frame of mind to have the conversation? Do you have the time? Can you take your emotions out of it? Or you have something going on in your life that might make you react a little more hostile or aggravated or short at the person you're trying to talk to? Are you ready? Is the timing right? Do you have the right skills? to have those conversations.
Those are all great questions.
You know, those you've got to, as a manager, your frame of mind and your mental health is something you've got to look after to be able to look after the mental health of those who work around you. So if you don't feel that that's you, I mean, that's fine. Figure out who that person is. That HR department resource should be your go-to. And it's not always a good conversation to have with just one-on-one. Sometimes it's have another person with you, like that HR person. While that can be intimidating, they have more skills to handle the situation in a way that, hey, we can just kind of see this is going on, and we want to work with you. What can we do to help?
So with that, I would say there's a couple things that just kind of come to mind. I would not have this discussion Monday morning, in the afternoon, especially on a Thursday or Friday, if that's kind of the end of the day, if you can. Reason being, with contaminated thinking, if I get called into the manager's office at any of those times, I'm already thinking, I'm about to get canned. Right? So it increases these feelings of anxiety, and if I'm already anxious.
Putting up walls.
Exactly. So the time of day, kind of what that schedule looks like. So if it's after lunch, maybe that's a better time. We've eaten, and hey, come here, I want to have a chat with you. It's also how you phrase things. Because and that's where a lot of those questions, the kind of hypothetical questions we're talking about is, if I said, Benna, what's going on with you? Why do you keep being late? We're trying to meet the bottom line here. Then it's just walls are up, and you're not gonna be receptive, and you're not gonna tell me what's going on.
And the productivity for that person for the rest of the afternoon is definitely shot.
And then that can also cause where they're distracted, and then we're having incidents occur. So being the right person is having enough time where it is unlimited to have this talk, because once they start talking, they may just let it all come out. So asking questions that are more empathetic, and the way you frame that question, could be something like, hey, Benna, I noticed that you've been tardy a lot. How's everything going? Or, is there anything I can help you with?
Right.
Oh, well, I've just been super tired because of such and such, Okay. Well, what can I do to support you with that? Would it be a little helpful to come in a couple hours later tomorrow so that you can get that taken care of? Absolutely, that'll be such a big help. Right?
Exactly.
It allows, and they're not the closed-ended questions. It allows that other person to speak to you to as much as they're willing to give.
Yes.
Without it feeling like an intervention.
Right. Oh, exactly. Because, boy, talk about putting somebody back on their heels. That'll do it fast. So what you're talking about, solutions to what's going on, and I think that, I had some points that on that were like, in your mindset when you're going to have this conversation, am I looking for solutions or just rehashing an issue? We often look past, we have to look past ourselves as managers because we're only human too, so we're in there having anxiety issues probably at that same time. And of course we are. Nobody wants to have those kind of conversations with anybody. I mean, it's very uncomfortable. Am I approaching this to bring the right behaviors, or am I just focusing on the wrong behaviors? So very much like kind of what you were saying there, that fits in that guidelines. And am I looking for long-term improvement or just short-term results? So, I mean, there's so many questions that managers and supervisors and stuff, they need an arsenal of preparation. We talk about in root cause analysis, Barb does all of her, her discussions about how to prepare for interviewing when an incident's happened, you're interviewing your witnesses or those involved. A lot of the things that she talks about in that, the building rapport, all that type of stuff, really could play in very well in these conversations.
Oh, definitely.
Yeah. So if people haven't seen any of that, I know we've got some articles online about effective interviewing techniques, and we've got some YouTube videos where she talks about that, your nonverbal communication.
Yeah.
All those types of things can help you in these conversations.
And in those conversations too, it's not trying to get, in this particular instance, it's not trying to get all the facts and create a timeline. It's not as rigid, but it does follow a lot of the same lines of just trying to find out what's going on without being defensive. It's a maintaining control of your own emotions, and I think we do a really good job about that when we're building a snap chart.
Yes.
I just want to see the big picture of what's going on.
Exactly. And the outcome you're looking for, I mean, you're wanting to work with the employee on a plan to succeed. Not be like, here's what you've got to change. You know, like you were saying earlier, you're asking that person, would it help you if, or even ask them, what do you think would be a good solution on this? And then have your next steps. You know, you don't just do that and then drop it and say, okay, well, let's check back in here in a week or so and just see if that's helping, if we need to tweak anything. And that makes them feel like they're cared for. And in this world, it's really easy to not feel cared for.
Yeah.
And so I think that partnership, and it lets them know they're valued. And a lot of times workers can feel like they're not valued. And that if they're having home issues and things like that, and then that it gets compounded at work, you know, it's just, you can actually probably change maybe what's happening in their home life by making what's happening in their work life better.
Oh, you mean you're supposed to leave work at work? You can't bring work home? No, it happens. Absolutely. I hear you.
Well, I love it. I think this is a good overview of how people need to think about things. And like we said, this is a conversation that could go on for hours because there's so many different elements to how you can talk about these things. There's a whole nother topic on how you take care of people after an incident's happened. And I remember when I gave this talk several years ago, you know, a lot of the questioning there was, well, how do as managers, who takes care of us? You know, we're supposed to be if an incident happens, they're as emotionally traumatized as everybody else, but they're the ones that have to go and make sure that everybody else is taken care of. And so there's that issue. I mean, there's just so many.
We could even go down
so many
what if they don't want help? Then what?
Exactly.
And then, you know, well, if it's impacting, you know, a safe work environment, then you kind of have to be the bad guy or girl to say, hey, man, I've tried to talk to you.
Yes.
You keep doing this. This is putting other people at risk. And there could be consequences for that, you know. So there's some steps in place, and you know,
because sometimes there are problem employees. Some people just are, and you have to be able to decide if that's the case, and they're not accepting the coaching, they're not responding to wanting to work things out. They don't change, and they have no good reason for other than. I mean, some people don't have a good work ethic.
Or some people are private and they don't want to talk to you about it.
Yeah, there's so many different little reasons. But eventually, at the end of the day, if it doesn't get worked out, then some serious decisions probably have to be made. But luckily today, there are so many great human resources out there to help. And it's just learning what works in your company. Make sure you know where your resources are. If you're a manager or supervisor and you don't know what is out there in your company to help people that are going through a difficult time, that's something you need to find out.
One thing I want to end with, it's an acronym that's helped me a lot, and it's HALT. Hungry, angry, lonely, tired. And this is when people oftentimes aren't acting like themselves. It definitely puts us in positions where we could have incidents, accidents, and things like that. So if you're on a job site, you're a manager, you're trying to build rapport with your people without being in their business, one thing you could do is when you have your job box talk, have a basket of snacks and say, hey, who's had breakfast? Right? Yeah. Well, guys, here's some snacks. We need to make sure that, you know, we are feeding ourselves cognitively. We got a big workload going on today. It's a small gesture, But then more things like that will show that you're approachable,
That's a great
you
idea.
care, and you're looking out for your people.
Yeah,
You
that's
can
a
go
great
buy
idea.
a box of granola bars for a couple bucks.
Well,
Yeah.
and I know I've seen at our summit sessions where we'll have people there that help with working on. We had the lower back pain, and you saw there in the class that these people, they have their people doing manual labor,
Yeah.
doing stretches and working to help them, not
Absolutely.
help them avoid injury. Well, help them avoid being hungry and angry and hangry. Help them with that. That's such an easy thing to do.
Yeah.
And you're right, it shows they care.
Yeah.
So, well, this is great, Emily. Thank you so much for talking to us about this today. And we hope everybody out there got some takeaways from this. As I said, we'll put in the description some of the resources and references for some of the things that we've talked about. And find some other, maybe some links that you can go to to get more information. But we do suggest you start with your own HR department. And let us know if you have the ability to comment. Are there some mental health topics that would interest you that would help with your employees at your company? And if, like we said, post care of incident after an incident, that's something we've talked about doing in the past and might be a good future topic. So, but thanks for joining us. We'll see you back here next time. Bye bye.